Good morning to everybody. I'm really happy to welcome you to the Nutrition in SMA workshop. My name is Xenia Gorni and I'm a Senior Global Medical Director and Medical Affairs at Roche, and I'm a child neurologist with special interest in neuromuscular diseases by training. Today, and before going into the details of this event, I would like to introduce you to the co-host, my co-host here, Dr. Nicole Gousset. Welcome, Nicole. Nicole is the president of SMA Europe, and in a period of great changes for SMA, and during many years of collaboration, she always made sure that patients' voice would be heard and understood. So I'm really happy that she's here with me today. And Nicole, would you like to say a few words?
Thank you very much, Xenia. Yes, a very, very warm welcome from SMA Europe. We are an umbrella of patient organizations across Europe, and we strive towards optimal treatment and care for all the patients living with SMA. And we do that by raising awareness, but also by advocating to find solutions for the needs in our community. So one way, I'm sure, is through fostering patient-relevant research. And also as an organizations, we are actually collecting data ourselves on patient experiences and needs through our patient and community surveys, UPESMA. And in our latest UPESMA survey, we actually focused on nutrition. An area we know is of critical importance for the patients, for the families living with SMA. And today we are really happy to present you some results of that survey later, but also we are glad to have this opportunity to co-host this workshop. It's really a possibility for all of us to collaborate further, but also to really accelerate progress in this area, in this very important area. And only all together we can bring change for our community. So I would really want to express a big, big thank you to all the experts who will be sharing their insights today with us, but also a big thank you to Roche to make this happening. With this, I hand back to Xenia.
Thank you very much. So very quickly, I want to show how extensive and expert faculty we have. I will not go through each of them because they will be presented throughout the days, but just to say that they're coming from all parts, geographically speaking, but also all kind of expertise. So we really hope to bring some knowledge and experience on the table. We have, of course, there are financial disclosures here. And we have a number of objectives, maybe ambitious, but I hope this is the beginning of a series of collaborations. And so we really want to raise the awareness. As Nicole said, that's a very important topic and maybe a little undermined until now. So we want to raise the awareness, understand what we know, what we do not know, and where we should focus. We want to do that through the expertise of clinicians, but also the experience and the knowledge of patients and their real-world life. We also want to concentrate on one aspect of nutrition, or a particular one, which is swallowing. So understanding, because that's quite important as a reflection, understanding again where we stand, also in assessments and what we can ameliorate. And finally, we would really want to have a panel discussion to understand what are the best practices in place, what are new projects, and maybe a call for action for other collaboration that will bring further understanding in the field. And this is the agenda that is reflecting exactly what I expressed until now. We have 4 sessions, and I would like, without waiting or wasting too much time more, to start the first one by introducing Professor Giovanni Baranello. He's a pediatric neurologist at UCL and Great Ormond Street Hospital in London. And he will be the moderator of the first session and will be then introducing the speakers of the session number 1. So thank you very much, and I hope you will enjoy. Welcome, Giovanni.
Thank you. Hi, everyone. Good morning or good afternoon. I'm very pleased to be here and to introduce this first session that will bring you through this journey about nutrition. And I really like to have this session as a joint effort, because you will see that we will start setting the scene with the experience from Yasmin Erbas, that will talk to us about her experience. She's a mother of a child with SMA type 1. And then we will continue with the experience brought up together from Simona Bertoli and further on from Ramona De Amicis. They are two researchers at the University of Milan that have a long-lasting experience on investigating all these nutritional aspects in SMA. And in between the two presentations, we will have a direct experience from Sarah Armo, that will talk about her own life with SMA and her management of nutrition. So I'm very happy to start with introducing Yasmin here. Thank you.
Good morning, everyone. So today, indeed, in this session, I will be talking about my experience as a mother of a child with SMA type 1. My son is currently 7 years old. He was diagnosed with SMA 1 when he was just a month old. Luckily, he was able to start treatment very soon after that. And probably because of this, for the first 2 years of his life, he was able to eat by mouth, so he did not have a feeding tube. But when he was around 2 years old, his treatment was stopped for a certain period of time. And during this period, his swallow got weaker, and we had to decide to give him a feeding tube. And from then onwards, he started having liquids by feeding tube, but he was still able to eat purees by mouth. When he was 4 years old, he got very sick, and he was intubated for about 2 months. And during this time, he unfortunately completely lost his swallow. And since then, he is eating completely by feeding tube. But of course, tasting food is still very important to him, so he does frequently taste food. And his favorite foods are currently honey and apple, but this changes very frequently at this age. So in this session, I will be talking about several challenges that we are experiencing parenting a child with severe SMA type 1. But before I move to the challenges, I also want to make a positive note. So despite all of these challenges, my son is actually able to enjoy life, to do fun things in life, and we try to make it work for him. And on this picture you see here, we are actually on a road trip in the Swiss and Austrian Alps, and we are having a lunch break. So he is having a picnic, he's receiving his tube feeding and enjoying the beautiful scenery of the Alps. But then the challenges that we experienced, I think I am, okay. So I will start with the nutritional challenges. I think the main question that we have as parents is that we really do not know what a healthy diet is for our son. So what is it that he needs? Which nutrients does he need? How many calories? How much protein? How much fats? How many carbohydrates? Does this change when he gets stronger or weaker? How does this depend on his physical ability and his muscle? Does this also change as he gets older? We are also not sure whether we should supplement him with vitamins. For instance, vitamins that can be important to certain symptoms of SMA, such as fatigue or weakness. But also other symptoms such as bone health. Do we need to give him more vitamin D or calcium than the average person? We have no idea. Another, I think, important aspect is we don't really know how the dietary choices that we make for him, how these are related to his SMA symptoms, so how his diet influences his strength, how it influences his fatigue. And then finally, we don't really know what a healthy weight is for our son. So our son, with the current diet we are giving him, he's having a blended diet. So this means I am every day making his food, his breakfast, lunch, and dinner with fresh food. He is able, I think, to maintain a healthy weight. But in fact, we don't know whether what we think is a healthy weight for him, whether this is actually a healthy weight or whether he is perhaps overweight for someone with SMA. Okay, then I will move on to the gastrointestinal challenges that he experiences. So my son, like many other children with SMA type 1, has a small stomach, so he cannot have large volumes of food. He also very easily vomits, bloating, reflux, constipation, sweating, higher heart rate when he gets food that he has difficulties digesting, are all things that we frequently see in daily life. Another issue that we have is positioning. So for him, sitting up can be quite challenging sometimes. Also, when he sits, he needs to wear a brace that presses on his stomach. So this can, of course, make eating a bit more challenging. But then he can also not completely lie down when he is eating, because this can, of course, increase the chances of vomiting, reflux, and so on. So the positioning is always a bit of a difficulty. And all of this together makes it that we really very carefully need to time his feeds. We need to plan our day very carefully. And we also very deeply need to think about which ingredients we feed him. Like I said, he cannot have large volumes, so we need to select these very highly nutritious ingredients. A next issue that we experience is related to swallowing. So as Giovanni mentioned, we will be hearing a lot about this today. Swallowing is of course important. In my son's case, the lack of a swallow prevents him from eating food, but it also makes it difficult for him to manage his secretions and mucus in his throat. And I think most importantly, this lack of swallow increases his chances of choking. And we know that a choking experience is very scary, and especially anticipating a future choking experience or knowing that this can happen again in the future, of course, causes anxiety in my son, but also in us. We also know that choking can increase the chances of having a chest infection, and unfortunately, there have been many, many cases of children dying because of choking. And because of all of this, I think a weak swallow or a lack of swallow really decreases the independence of people living with SMA. And because of that, I think it's very important that we look into how we can improve swallowing function. Then a final challenge that I would like to mention is the psychological aspect. I think this is something that we do not talk about enough. So with regard to my son, I think the fact that he eats differently than most other people really influences his self-perception. At his current age, it's not really a problem for him yet, but of course this might change as he gets into adolescence. I think another aspect is that food has really a very important social function in our culture. It's very symbolic, and many social things that we experience in our lives, get-togethers, for instance, they all revolve around eating. They all revolve around food. And I think it's, for us parents, very important that we are mindful about this and that we very carefully think about how we can include our children in these social gatherings and how without them feeling left out, basically. Then from my side, again, had the social function of food. For me, this means that I really need to change our family habits. So this also means that I do not have very large meals around my son because it makes me feel very guilty. It also means that I need to plan our day almost entirely around the feeding times of my son, again, for some of the challenges that I've mentioned before. And I think many of these challenges that we experience really increases my insecurity. So it causes lots of stress and worry because I am really unsure whether I am making the right dietary choices for my son or whether the foods that I am giving him are actually harming him. I have no idea. So to end, I have summarized the questions that I have, the open questions, and I think many other parents like me. So we would really like to know what is a healthy diet for people living with SMA, what is a healthy weight for people living with SMA and how we can maintain it, how can we improve swallowing function, and also how can we better address the psychological impacts of nutrition-related problems in SMA. Thank you.
Thank you for the invitation. In my presentation, I will discuss why nutrition care is important in the management of SMA disease, and also how to do it, concerning specifically on what is the way to assess nutritional status, body composition, and also energy need. People with SMA are at risk of becoming underweight and also to becoming overweight and obese. And this condition is really very frequent because we know that about 12 to 60% of people with SMA have a nutritional impairment, always associated to feeding difficulties. Underweight is typically a condition occurring in SMA type 1 and type 2 with low functional level, and is the consequence of respiratory problems that induce an increase in energy expenditure, and also to the appearance of gastrointestinal disorder that induce progressive reduction in food intake. On the other way, we know that overweight and obese condition occur in type 2 and type 3 SMA, and this is the consequence of a severe neuromuscular deficit that decrease the physical activity level, and also because we know that during the disease there is important changes in body composition that induce a decrease in resting energy expenditure. The alteration in nutritional status is also associated to alteration in the quality of diet, and in particular in the modification and alteration in macronutrient and micronutrient intake. These changes in quality of diet may be associated to metabolic alteration, in particular to glucose alteration metabolism and lipid metabolism, and also to deficiency in growth pattern and bone mineral density. Concerning this alteration in metabolic aspect in SMA, we know that type 1 SMAs is always associated to hypoglycemia, specifically after a short-term fasting, but we also know that patients with type 2 or 3 SMA with an increase of fat mass are frequently affected by hyperglycemia and also metabolic syndrome, that are conditions that induce the risk of diabetes in a long term. Concerning alteration in lipid metabolism, we investigate this aspect in children affected by SMA, but the same results are also reported in animal model, and we found that patients have a dyslipidemia and also hepatic steatosis. Finally, concerning the bone health, we know that osteopenia is present in all patients with SMA, and this increases the risk of bone fracture. For all these reasons, nutritional is become a central aspect of the management of SMA patients, and for this reason it is important to start to investigate the nutritional status and also the nutritional need according to a good protocol for the assessment of this. In particular, the last guideline suggests that an expert nutritionist should be involved in the monitoring of growth pattern, and also to define the appropriate energy intake and the correct diet. And this assessment for an optimal care may be conducted every 3-6 months in younger children and at least annually for older children and adults. So, if it is important to do it, how can we do a correct assessment of nutritional status? The most simple method to assess nutritional status is the evaluation by anthropometric measurement, specifically height and weight, that allow to calculate body mass index and to classify the nutritional status in underweight, normal weight, and obesity condition. However, specifically in neuromuscular disease, may be very important to assess body composition. Study body composition means to understand how is composed the body weight, in particular, at least in the basic model on fat mass and fat-free mass. We can measure fat mass and fat-free mass with several methods. Some of these methods are considered gold standard, but are very accuracy, but are not used in clinical practice for the difficulty in the management and also because sometimes are not so safety. For example, dual X-ray is a method that use radiation, and so it is not a safety for follow-up monitoring. And for this reason, generally we use more simple methods such as bioelectrical impedance and skinful thickness. Body composition has been studied in SMA patients, and we found that is very different, the body composition of SMA patients compared to healthy children. In particular, children with SMA have a low fat-free mass, but also they have an increase in fat mass. And moreover, we understand that different SMA phenotype may be different body composition. So to study this component is very important to improve our ability to understand the nutritional status. The anthropometric measurements are difficult to take in a neurological disease for the frequent retraction and also for the presence of scoliosis, but also are difficult to interpret because are not the same that we can find in healthy children. To super this difficulty, we study a method to standardize the process to evaluate anthropometric measurement and also to improve the interpretation thanks to the development of chart specific for SMA disease and also predictive equation to estimate total body adiposity. The first one is our method to develop a procedure manual to assess anthropometric measurement, and we also assess the reliability of anthropometric measurement assessed in SMA patient, demonstrating that they may be take in a good way and very useful, but after a training, because it's not the same that we can use in healthy children. Concerning the growth pattern in children with SMA, we study a large sample of SMA patients, both type 1 and type 2, and we develop the growth chart. In this picture, you can see the the growth chart for SMA1 and SMA2, and for male and female, but also in the borderline we have the growth chart, the growth pattern of SMA patient, and also in comparison with the chart of WHO for healthy children. And it is very clear that there are very relevant difference in the growth pattern between SMA patient and healthy children, and this may induce a different nutritional management, in particular a different approach in the diagnosis of nutritional status. Concerning the predictive equation to assess body fat mass from anthropometric measurement, we investigate if skinful thickness, that is a very easy method to measure the adipose tissue, may be used for the assessment of total body fat mass in SMA patient in comparison with DEXA scan, that is the gold standard method for fat mass, and we produce two set of equations, both for female and for male, different for age, in which we can calculate fat mass percent by the simple measurement of skinful thickness. And this may be useful in clinical practice to investigate body composition at the first level. If we know that there are very different alteration in body composition, then we can use also more invasive methods such as DEXA scan. The last thing is related to energy need. When we start a dietary program, a dietary intervention, the definition of how many energy are needed to improve or maintain a correct nutritional status is the first step. The gold standard method to investigate the energy need is indirect calorimetry, that measure energy expenditure by measuring the gas exchange, but this is not routinely used in clinical practice, essentially for the lack of availability of calorimeters, but also because there is a high cost in the device, and also the time to do the measurement is not so short. So generally we use predictive equation to estimate basal metabolic rate, that is the larger part of energy requirement, and in SMA this basal metabolic rate is the more important energy expenditure, because the amount of energy needed for physical activity is limited, and so if we know the correct amount of basal metabolic rate, we can define with a greater precision the amount of energy need. So when we use the predictive equation typically performed for the healthy people, we demonstrate that these equations are not useful in SMA patients because underestimate or overestimate the energy need. And starting for this observation, we produce a predictive equation to estimate the energy need in SMA patient, also taking into consideration the more relevant clinical variable associated to energy need. And in particular, we show that the more relevant clinical variable related to energy need were the kind of braking, spontaneous braking or ventilation, and also if were present a treatment for the disease. Starting from this observation, we produce two sets of equations. The first one to be used for patients with spontaneous breathing, and the second one for children in mechanical ventilation, in which using simple anthropometric measurement like body weight or supine length or tibial length, we can calculate the energy need. So, the role in nutritional care in SMA is very important in order to optimize the state of nutrition and also growth pattern, and also to early assess the nutritional impairment both on the underweight, then overweight and obesity. To do this, we have to take at least anthropometric measurement. We have to quantify body composition, at least in the component of fat mass, and we have to schedule an evaluation by a dietitian every 3-6 months for younger children and annually for older children. We have also to estimate the correct amount of energy need and to identify the gastrointestinal disorder that may impair the food intake. And finally, we have to provide a dietary support when we found a nutritional status impairment. In conclusion, we can say that an active nutritional support and metabolism survival are very crucial for people with SMA, and particularly in the new era of the treatment, because we are looking to new phenotype and of SMA, and the nutritional management may have a significant impact on the clinical course and even on the prognosis in SMA. In my opinion, it may be very important to start a longitudinal study to investigate the better nutritional approach in SMA treatment that at this moment is not so clear. Thank you for your attention.
Yes, hello everybody. My name is Sarah Almroth and I am from Sweden. I am 41 years old and I have SMA type 2. I live here in Sweden with my husband and his daughter. I have a bachelor degree in biomedical science and work as a cytotechnologist and quality manager in a department of laboratory medicine. And I'm also a vice chair in the Swedish organization for SMA. I live a quite ordinary life with family life and work life and spare time, despite my SMA. And for this, I need to have good energy. I'm interested in nutrition and how to stay healthy despite this disease. And I'm interested in training as well, or exercise. Like I said, I'm quite active. I spend a lot of time with my family. I sing in a choir. I like gardening, take a ride with our boats and so on. That's a little bit about me. Here are some pictures from my life. In the middle, you see me on our boat. And on the left side, you see me doing arm cycling, which is one of the way one of the training I do, or the exercise. And on the right side, you see me hanging in a ceiling lift, which I use to transfer between my wheelchair and the shower, for example. But when I'm hanging in the air, my legs are free and I am able to move them in a running way or kicking my legs. And when I do this, it takes a lot of it's quite hard for me to do this. And I have an activity watch on me so I can follow my pulse, and I get a higher pulse when I do this. So I get some cardio training while kicking in the air. I call this air running. It's a big challenge to know how to have the right nutrition and for the weight control. I have been both underweight and overweight. When I was younger, I was underweight, and it was a struggle to get me to a healthy weight. But then we managed to do this, and I had a quite what we thought was a good weight for a couple of years. But then I started to gain instead. And when I was about 35, I was overweight. I don't really know what happened, why I went from underweight to overweight. It may be poor nutrition. I ate more sugar and white bread and saturated fats and fast-acting carbs, so on. In those days, there was limited activity. I wasn't so into exercise training. And I also developed a hypothyroidism, and this, of course, had an impact in me gaining weight for a while. But then I got medicine and got treated for this. So so it shouldn't have any impact now. I also had other challenges. It was I struggled with heartburn and acid reflux, quite hard fatigue with the rapid heartbeat and so on. And I often got cold and lung infections, about 3 to 5 times a year. And I was ill for about 2 weeks at a time. Quite hard. But I have experienced it. In my experience, it's hard to find any scientific about what is the right nutrition and how and which weight are optimal when having SMA. And there, I haven't got any good guidance from my doctors or dietitians because they don't know either. They use the normal what we usually say to people, how to eat and which weight and how many calories you should stay on and so on. And this doesn't, I don't believe it's adequate for people with SMA. So I started to self-care to try to take control over this. So I changed my diet. I wanted to get more energy. I wanted to lose weight, and I wanted to get rid of this gastrointestinal issues. So I started to Google around to try to find some information about nutrition and physical exercise for people living with neuromuscular disease, or I also looked into how to treat paralyzed people and so on, just to get some inspiration on how to think. When I looked into physical exercise, I couldn't find anything that said that it had a negative effect on SMA. This when I was younger, one said to me that you should be very careful with exercise when you have SMA, because it could have a negative impact and make you become even more weaker. So that's why I didn't dare to train too much until I started to look into this a little bit more by Googling around. Well, so I got more and more interested in trying to get a better health despite my SMA. Well, I changed my diet. I now often eat shakes for breakfast and lunch at weekdays. Not only because I feel better, get more energy, because then I have a good level of energy intake, and it's also easier at lunch break on my work only to drink the shakes and not to use the body so much and have the strength to eat, because it takes a lot of energy also to eat. I eat by myself. I don't need help with that, but it's quite energy demanding. To get rid of the gastrointestinal issues also, I changed, I lowered my sugar intake, and I drank ginger and lemon shot for a couple of years, and I did a different kind, a lot of changes, both to lose weight, get more energy, and to get rid of the gastrointestinal issues. And I started to take some supplements also. I have a higher intake of protein in my diet now. And I keep fast-acting carbs and sugar at a minimal intake. And I have again interest in especially anti-inflammatory diet, because it sets the body in cell reparation, and I believe that's a real good thing when you have SMA. That's my belief. My training, cardio training in the air running, arm cycling, vibration plate. I put my feet on a vibration plate. This is to speed up the blood circulation and to get rid of lymphatic fluid from my legs. I use cough assistant and tree flow for breathing exercise. And singing. I believe that singing is not only fun, but it's also a very good training for the breathing and for the neck and for the muscles in throat and mouth and so on. So I think it's a good thing to train for these things. And I try to do as much as possible by myself. I don't take help more than I need, and I think that's important to do as much as you're able to do. I believe there is a need for guidance on nutrition. How many calories should you eat? I have tested and come to a conclusion that for me, it's around 1100 calories per day. If I eat more, I start to gain weight. And how much protein, how much carb, and so on. What should we eat? And tools for physical exercise beyond the physical therapy. I also use electro training, EMS, for my stomach, for example. So you can train for a lot of different ways. And I believe in focusing on strengthening the body in other ways than just muscular, improving blood circulation, reducing lymphedema, improving the gastrointestinal health, and reducing the chronic, small chronic inflammation that is going on in our body often. Together, I think that this will give more energy. Yes. Thank you.
Good morning, everyone, and welcome to my presentation. As a dietitian, my topic is to show you what are the current unmet needs in the dietetic management in SMA. And I can say it's a hot topic. In the recent years, many milestones have been achieved in the nutritional assessment in SMA, which allows us to correctly diagnose nutritional issues and monitor them over time. But what do we know about dietary interventions? There are specific dietary recommendations for SMA disease. As shown by Professor Bertoli earlier, the basis for understanding the dietary recommendations of SMA has been laid, such as growth pattern evaluation, body composition assessment, energy requirements calculation. But these informations are sufficient to tailor a specific diet in SMA. I will try to answer point by point. When we talk about dietary recommendations, we talk about the recommended and optimal dietary intakes that support the differences by sex, age, weight in the general population. But we talk also about the tolerable upper intake levels of nutrients that are free of side effects. And what we know about these dietary reference intakes in SMA. When we do a Medline, as Sarah pointed out earlier, we found just 7 results. These results are studies made in small SMA populations and that conduct to a different results. So I'll try to show you what we know to date on the SMA dietary management. Starting with the calories need, we can we know today that how to measure basal metabolic rate and also how to estimate the basal metabolic rate in SMA1 patients. But what is still missing in how to estimate this metabolic rate in SMA2 and SMA3. Basal metabolic rate is the energy need for the vital functions and represents the 60% of our total energy requirements. What we don't know to date is what is the energy effort that an SMA subject do in the daily routine activities and in the dietary thermogenesis. So we need to date clinical studies that measure with a specific test what are the estimated energy requirements for the daily routinary activities. Turning into macronutrients, more we know about fat metabolism. In our sample, we found that SMA patients reported at least one dyslipidemia, And when we analyzed specific fat metabolism in SMA, we saw that these defects, especially we found in animal models that these defects occurred earlier than the motor function loss. So these results suggest us that these fat metabolism defects are due by metabolic defects in other organs and not correlated to fat mass in SMA. When we analyzed results made by only in animal models on the efficacy of high fat or low fat diets in SMA animal models, we found contrasting results. As shown in this last review, we saw that there is a study that reported an improvement in lifespan in SMA with the high-fat diet. But there is another study that conducted to the opposite results with an improvement in lifespan in SMA with a low-fat diet. What is cross-sectional feelings in clinicians worldwide, and is based on also our clinical experience, is that people with SMA seem to tolerate not more than 20-25% of lipids of total energy intake. But we can do a conclusion, and clinical trials are really needed with different types of diets to understand the usefulness of high-fat or low-fat diet in the disease progression. Turning to carbohydrates intake, even less is known. When we analyzed our large SMA sample in Italy, we found that there is 10% of patients with an impairment in glucose profiles. And SMA1 have a glucose profile worse than insulin profile worse than SMA2. But when we correlated this glucose metabolism to body composition in specific to lean mass, we found no correlations. And this suggests us that this impairment of glucose profiles is probably due to a pancreatic defect found in the animal model. So to date, we need specific clinical trials to understand if a high carbohydrate diet and what is the cutoff in carbohydrate intake well tolerated in the SMA disease. Concerning protein intake, there are no studies to date. When we starting to study the consumption of protein intake in our SMA samples, we found that protein intake was higher than the recommended values for healthy peers, about 50% higher than the recommendation. And these findings were also in other states as USA, also UK, and also in a Russian population. Asking to caregiver why there is a higher intake of proteins, caregiver belief was that more protein are linked to more muscles. So we tried to analyze these correlations in our sample, and we found no correlations. There is no relationship between protein intake and fat mass amount, fat-free mass amount. Indeed, what we found that protein intake is directly correlated to fat mass amount, suggesting us that probably a higher protein intake, not combined with higher motor activities, is linked to higher lipogenesis, not in more muscles. So what we really needed to date concerning protein requirements are to study the balance between the proteins consumption by foods and protein excretion by urine, fecal loss, hair, and sweat. Because we don't know to date if patients with SMA are normal, mild, or increased or severe catabolism. Last but not least, there are several studies on supplementation in SMA because there are different deficits analyzed in biochemical parameters, but to date, for example, creatine or carnitine supplementation is not related to a higher functionality. And what we know today is that the only demonstrated useful supplementation is made by vitamin D, calcium, and magnesium to improve body composition and bone density in people with SMA. So now the question is how can we treat underweight and overweight in SMA with this big amount of unmet needs? What we know is that we can treat underweight in SMA people, tailoring increasing and gradually increase in calorie intake up to 10% more than the energy requirements measured or well established estimated. And we have to maintain this 10% increase until improvements in body weight and growth are achieved. If we have to suggest a high calorie intake only when there is an intentional weight loss more than 10% per year or significant impairment of growth pattern. And concerning quality of diet, we have to stress in the underweight people with SMA using high protein or energy food fortification strategies. By contrast, we have to treating overweight people with SMA with a tailored and personalized diet based on population-specific guidelines and with a strict collaboration with patients and caregivers to improve the nutritional empowerment and the autonomy of SMA patients. And concerning energy intake in overweight people with SMA, the aim is to normalize calorie intake with respect of energy needs measured or well estimated. But when we talk about dietary recommendation, we talk about also the fiber and fluid needs to try to manage the gastrointestinal dysmobility. We talk about the types of feeding, food consistencies that we know to manage with the cooperation with other specialists as a speech-language pathologist or an occupational therapist. Dietary recommendations include also meal timings, the interaction that occurred between drugs and nutrients, but last but not least, as shown by also Yasmin earlier, we have to manage also the psychological issues of nutrition concerning aesthetic, social, and family aspects. So it is well understandable that nutrition is not a therapy for SMA, but it took every aspect of SMA disease. And with a well set up dietetic treatment, we can manage the side effects of a pulmonary function, of the acute care, of the medication, of the orthopedic problems, and so on. So we can conclude that nutrition is a core component of SMA, but to date, many efforts we have to do to better understand the impact that dietary intervention can have on SMA, on new SMA phenotypes, and dietary clinical trials are really needed. Thanks a bunch for your attention.
We are the end of the specific session on the nutritional management in SMA, and we have now live Q&A session, and I will go through the questions that are coming through the chat, so please post all your questions if you have. I would like to start with you, Yasmin, if it is okay for you. So one of the questions is, given that there are no current guidelines or specific random recommendation on which is the best diet to use in SMA or people with SMA, how can we be sure that everyone is getting the same standard of care, the same approach across the world? Can you give us your view, your experience as, an individual directly involved, and you are also active in the SMA Europe organization, so please.
Yes, thank you. So I am the mother of the type 1 child with SMA, but I'm also the vice president of SMA Europe. And this is indeed a very, very important question to us, and one that we also feel responsible for. So I think there are different aspects here, and I think for this we really all need to work together. So firstly, we need to know what are the needs of people. As Nicole mentioned earlier, we have our own UPESMA surveys where we are really surveying the needs of the entire SMA community. But then we also really need our scientific researchers and our dietitians to then go back to the lab, to go back to the clinic and really investigate this at a different level. But then we need all of us to, I think, disseminate these findings. We need to make sure that these findings, they reach all of the clinicians in the world. But they also need to reach the caregivers. They also need to reach the adults living with SMA. So I think here we have a shared responsibility to make sure that we know what the needs are. We need to answer these needs, and then we need to make sure that these answers, these recommendations reach everyone who needs to know them.
Thank you. Simona, can I ask you specifically, there is a question, do you recommend low-fat diet?
Okay, this is a very interesting question. I think that we have to consider the clinical phenotype of SMA patient to decide the dietary composition. For example, if we have a patient with a dyslipidemia and with a gastrointestinal disorder, in particular reflux and retardation in empty, a low-fat diet may be more useful because will be well tolerated. On the other way, if we have a patient in which the more problem is on impairment in glucose metabolism, in this condition a reduction of carbohydrate and a higher amount of fat may be a good solution. So I think that there is not one diet for all patients, but there is different nutritional approach according phenotype of patient, specifically on metabolic phenotype.
May I ask a follow-up question? Because we see in type 1, especially also the older ones, that they sometimes have fatty liver.
Yes.
Is this also related to a high-fat diet or a diet that is perhaps too high in fat for these specific individuals?
Okay, in SMA type 1, I think that maybe not the good diet, a high-fat diet, but I think it is better to start a low-fat diet with a higher amount of carbohydrate, because patients generally present hypoglycemia after a short time of fasting, and so a diet more with a more amount of carbohydrate may be more useful, I think. But this is our clinical experience, but a specific study to understand the long-term effect on metabolic aspect are not available. Now we are looking to the short-term effect, how if the patient present less gastrointestinal symptoms or a metabolic disorder, and we decide the kind of diet, but we have to look to a longer term to understand the really diet correct for SMA patient.
If I can also add to this, as clinician, we were not used to assess these children more regularly, Now that we are starting to investigate more in depth, if they have other abnormalities, actually it's quite common to find, as you said, fatty liver, for example. So definitely something that we should monitor more carefully, also to understand if it is, the underlying condition, as it has been shown from some studies, if there is something else, if we can act on this, because at the end of the day, the final aim of a dietitian or a proper nutritional management is to have an individualized approach to, to improve also the nutritional management. Ramona, can I ask you this question? So let's pretend that you are in your clinic and there is an SMA patient that comes to see you. How you discuss your the diet, nutrition, what do you tell them? Because you have accumulated, a big experience. You have seen many of these patients. So can you give us some suggestions, some advice? What happened essentially when they come to clinic?
First of all,
which are their concerns,
these questions requires a long answer, but I try to cut my answer. First of all, I collected all the anthropometric measurements. I try to understand the specific calorie needs. I have to understand what are the amount of fat mass of these specific patients and what is the growth pattern in the recent months, at least. And when we have all this data, I start to talk with patients about the dietary intakes. To date, I do a comparison between the dietary intake of SMA and the recommended dietary intakes. And when I see a deficiency or a big amount of protein or fats intake, I have to suggest a recalculation of the dietary. But I have to manage the daily receipts, the daily caregivers time that it is dedicated with in the dietary management. So it is really important to speak a lot with families' habits and to SMA patients also tastes, because it is really important to follow the tastes of the SMA patients to do an efficacy diet.
Thank you, Ramona. Sarah, can you hear us? Yeah.
Yes, I hear you.
There is a specific question for you here. So you mentioned an anti-inflammatory diet to combat fatigue. Do you feel that this is making a difference to your energy levels? Can you expand a little bit more on that?
Yes, absolutely. Yes, as I said, I have done a lot of changes in my diet and my activity level, and I have more energy. I don't experience the rapid heartbeat anymore, which I had from time to time before I did these changes, and I don't have any reflux or gastrointestinal issues anymore, which I usually before this I got medical treatment for, and I don't need that anymore. And since I started with this anti-inflammatory diet, I experience more energy than during the day. Yes.
Thank you, Sarah. And Jasmine, I have another question for you, if you don't mind. So I like that you mentioned the psychological aspects, of the nutritional management. And so what suggestion would you give to clinicians, for example, how to deal with these issues, with these aspects? Is there any specific aspect or advice that helped you, or you needed to, explore or to invent, some ideas on how to manage the impact that the different feeding that your child was having, to find a way that would not hurt his feelings. Can you provide some advice to people? And then probably from your perspective, Simona or Ramona, what kind, I know that you deal a lot also with these emotional aspects, in nutritional management. What can we recommend to clinicians, that see these patients and do not somehow hide, and do not mention these aspects, do not take consideration of these aspects? Yeah.
I think there are different sides of the story. So I also need to declare that I am a psychologist.
Okay.
And
Which
that,
is helpful. Yeah.
and that I think the pleasure that we get from tasting foods, this is a very important hedonic pleasure. It gives us immediate pleasure. I think this is a very important aspect of our lives. I mean, everyone really enjoys eating. So I think we always need to keep this in mind, that even if food cannot be swallowed, that still tasting is very important, and we always need to enable this, stimulate this. What for me as a parent was really helpful at some points was that I became friends with adults living with SMA, and that I learned through them how they look at their lives and how they deal with the challenges they have, how they deal with their eating and so on. And for me, this was really helpful. It was a real eye-opener. And I would recommend also for pediatric clinicians to talk to your little patients, but also go and talk to the adults and see how they retrospectively have experienced things in life. I think this is very valuable information.
Yeah, and before probably handing over to Simona, who can provide some also aspect about the feedback, can I just say, I remember, we worked a lot in Italy about SMA patients, and then I moved, 4 years ago to the UK, and you can see that although we speak always about standard of care, proper nutritional management, there is a huge regional variability. So you have seen that that Italian families and moms can spend hours because they want to maintain, to prepare the food, to feed still, by mouth. There might be more restrictions in the in their eagerness to go for a gastrostomy, for example, compared to other countries, with different cultural background. So yeah, Simona, what?
Yes, I think that the love of a mother to her son is also by food, is expressed also by food. So it is very important to valorize these aspects and to also look to the real world experience of patients that try to start specific dietary pattern, for example, anti-inflammatory diet, but we can also have other kind of diet that may be useful for this patient, for example, low FODMAP diet and so on. So in my opinion, it's very important to start a stronger communication between our clinical experience that is more devoted to understand how many essential nutrients are needed to maintain a good healthy status, and this is one aspect. The other one is to understand what is the better dietary pattern that may be considered not only the quality of diet, but also the cultural aspect and also the taste, but also the ability to the caregiver to transfer these aspects. So I think that the need to start a stronger communication between a caregiver and a scientific expert in nutrition.
I want to add to that because when you said the love of a mother, I think you are very, very right there. And for me personally, as I mentioned, I give my son a blended diet. So I handpick the vegetables, the fruits. I also have a Mediterranean background.
Yes,
Food is very important. I think we have been very lucky because we have a very supportive team, our dietitians, neurologists. But I also know that many parents who want to give a blended diet are not allowed to do this by the clinical team.
Yes.
And so indeed, I think dialogue is extremely important. And
yes.
to really talk together what is in the best interest of the child, but also in the entire family context, the dynamics.
Yes.
Yeah. Thank you.
And there is here, Ramona, probably for you, a specific question about the amino acid diet. You know, should we follow the amino acid diet? We know that there is a very active group of people, of families that advocate strongly. In the US, for example, but also in the UK, we have a very strong community of families advocating for the amino acid diet. So what can you tell us? I will say something about a study that we did, for example, at the Great Ormond Street Hospital, but, you know, what's the evidence? What's your advice when, you know, some family comes to you asking specifically on amino acid diet?
To date, the only evidence that we have is based on a study on the animal models. But there are a lot of patients that are following this type of diets because they are really empowered and involved in the dietary management. And the peer suggest a lot to use this amino acid diet. In our clinical experience, we saw about 10 patients following this diet, and they reported less gastrointestinal dysmobilities, for example, less constipation, or also less sweating. It seems that this kind of diet in some specific phenotypes of SMA could improve the quality of life. But to date, we cannot do a conclusion about it, and more human studies are needed. What Yasmin remind me is the words of some SMA adolescents that told me, also in Russia, that for them it's important also to touch foods, to see a lot of color during meal, and so also if an amino acid diet made by foods, artificial foods, is important that is accompanied by also, I think, tasties and natural foods, probably.
Can I add a very brief also parent perspective to this? Because I am also very familiar with this diet. We do not follow it to the dot, but I think these guidelines, they are extremely applicable to especially the older, the late treated type 1s. And I think many aspects of this diet are very much in line with the findings that you have presented and that we discussed. And our personal experience is also indeed that I mentioned the blended diet, but these are not mutually exclusive. That we also experience a really reduction in all of these symptoms, such as constipation, reflux, and so on. What I also saw, and I think the results that you presented, is that, for instance, ventilated patients, they require less calories.
Yes.
So this means also the opposite, right? That patients who breathe themselves require more calories for breathing. And I think one of the underlying assumptions of such diets is that everything that sort of helps people to digest more easily, to use less energy for just being alive is actually helpful. Yeah.
There are a couple of questions more really for practical guidance. One is related to how many times, per day the individual with SMA should eat. It's 3 times per day or smaller amounts of food, like 5 or 6 times per day. And also if there are specific recommendations about calcium supplementation, vitamin D supplementation that they should be taking.
Concerning the first question, I think that is better small meal for many times, at least 5 small meal in a day. This because reduce the gastrointestinal disorder and also maintain a well amount of glucose during all the day. So in my opinion, it's better 5. Concerning the second, vitamin D is the only vitamins that may be measured in the blood, and so I suggest to measure level of vitamin D and to define the amount of supplementation according to the deficiency, the value of plasma, the plasmatic value of vitamin D, because vitamin D is an lipolytic vitamin that may be accumulated both in adipose tissue but also in liver and may have also side effects. So it is not good to give more vitamin is possible, but have to be well defined. Similar for calcium intake. Calcium intake is quite easy to establish because we have not many food that contain calcium, and in particular the calcium with a good biodisponibility availability is the calcium contained in milk and so on, and so we can define how many calcium is the use for that patient, and when we know this information, we can calculate the amount of supplementation. And this is not difficult because the sources of calcium are few. Milk, for cheese, yogurt, and so on, water, and nothing else. So there are also food frequency available that allow to define the exact amount of calcium intake.
Thank you. And we have one last minute. Sarah, I wanted for you to give the final feedback. You were very, very proactive in trying to find your way, by combining a good nutritional intake, but also physical activity and so on. Is there any advice that you would like to give to the community, how to best address this issue? Was it difficult? Did you find much support around it? You needed to study a lot about that?
First of all, I think it's very individual, and you have to try and see what works best for you and for your child, and what is what you're able to do in terms of exercise. But I believe that it's very important. It's important for all people to exercise for have a good health. So try to find ways to activate the body by yourself or with some technical aids. And for nutrition, well, it was hard to find any support and guidance. So I just had to do some experiment on myself and to read about different diets and so on, and put together a diet that I thought it suited me. And so I have tried this. And it has worked out for me. Like I said, I have a better health, more energy, no reflux or heartburn, and I lost weight. So now I have a more adequate weight. I think, at least. We don't know exactly which weight I should be. But I believe that it's important to have a discussion with the care team, with doctors and so on, and to put more focus into nutrition and exercise, because I believe that's very important for the health.
Yeah, this really highlights, the importance of increased awareness among clinicians in the community, especially because otherwise, patients do them by themselves. So it's very important to, they can also make mistakes, so
Yes.
nutritional mistakes, so it's very important to, bring together the efforts and the science, the clinical perspective, and to organize, very careful and very well-defined and designed studies on the nutritional management. Okay, thank you. It was very interesting and a very interactive session.